Adamawa State in northeastern Nigeria is known to have a mortality rate of 885 per 100,000 from all ailments, the highest in the country, as against the national mortality rate of about 576 per 100,000 persons. These figures were released by the State Commissioner for Health, Dr. Fatima Atiku Abubakar, during a program to educate healthcare service providers on the need to promote healthier living amongst residents. The meeting, in collaboration with the EU and UNICEF, is aimed at developing a strategy to lower the state's mortality rate below the national level.
When we sit together here and agree, then we now decide how it is going to be disseminated to the grassroots. And disseminating to the grassroots, would involve even converting to look our local language, so that the people at the community level are able to understand that, look, they have a right to expect a certain degree of confidentiality of service provision from their service provider. And the service provider is under compulsion to provide certain forms of service to the client.
Participants stressed the importance of adapting the National Health Policy of the federal government.
But with this National Health Act, there are a lot of commitments from the federal that is now being translated to the state and local governments, and we are working to find all those linkages and strengthen those linkages between the local government, state and the federal government. And particularly when the National Health Act announced with the National Health Policy is providing the guidelines on how this relationship will be strengthened.
It's not going to be exactly like it is the National Health Policy is. We're going to domesticate it, looking at our own context. So definitely it means that our people that are in dire need of health interventions in the communities will not have to struggle the way they are struggling before to access health services. It means more access to health services. It means more quality service delivery.
The National Health Act 2014 provides a framework to regulate, develop, and manage the national health care system. It sets standards for the overall health system of the Federation and the responsibilities of the constituent units of the health sector.